The Ottawa ankle rules indicate that an X-ray is required after acute injury if the patient experiences pain and any of the following: inability to bear weight for 4 steps either in the emergency department or immediately after injury, bone tenderness in any of the following locations: the distal 6 centimeters of the posterior edge of the tip of the tibia or to the tip of the medial malleolus, the distal 6 centimeters of the posterior edge of the fibula or to the tip of the lateral malleolus, pain over the navicular or at the base of the 5th metatarsal. The test item cluster for patients likely to benefit from spinal stabilization exercises includes the following: age less than 40, average straight leg raise greater than 91 degrees, performed in supine with the leg extended, aberrant motion, which includes an instability catch, painful motion, thigh climber and pseudo-Gower sign, or reversal of lumbopelvic rhythm, and a positive prone instability test. So to perform that test, I'll have Kat lean over the table. I'm going to provide a PA force to the lumbar spine. Then I'm going to have her go ahead and, holding onto the table, raise her legs off the ground. And again, I'll provide a PA force, checking for pain with both of those tests. The test item cluster for patients likely to benefit from spinal manipulation includes the following: current episode of pain 16 days or less, no symptoms distal to the knee, an FABQ work subscale score of 18 points or less, at least one hypomobile segment with motion testing, and one or both hips with 35 degrees of internal rotation or more. The McMurray test is used to check for meniscal injury. To perform this test, I'm going to go ahead and flex the patient's knee. To check the integrity of the medial meniscus, I will externally rotate the foot, and with my hands on the joint line, go ahead and provide a valgus force while extending the knee. And I'll do that a couple times. And then to check the lateral meniscus, I'm going to internally rotate the foot, provide a varus force, and extend the knee. And I'm looking for any popping, clicking, or pain. The anterior drawer test is used to test the integrity of the anterior cruciate ligament. To perform this test, I'll place my hands behind the tibia, my thumbs on the joint line, and provide an anterior pull on the tibia, looking for any anterior translation. The slump test, a neural tension test. All right, Kat, what I want you to do first for me is go ahead and put your hands behind your back like this. Go ahead and slouch forward. All right, bring your chin to your chest. And I'm going to apply some overpressure in this position. I'm going to slowly extend her knee. And then I'm going to dorsiflex her foot. Kat, go ahead and lift up your head for me. And then I'm going to relax her leg and ask how her symptoms change throughout the test. The test item cluster for identification of hip osteoarthritis includes the following: active hip flexion elicits pain in the lateral hip, active hip extension causes hip pain, the patient reports squatting as aggravating to the hip, and the patient's passive hip internal rotation is less than or equal to 25 degrees. The last portion of the test is the scour test with pain into adduction, which I will demonstrate. Just check her motion first. And then I'm going to add compression. The Faber test is used to check for hip and sacroiliac joint dysfunction. The anterior drawer test of the ankle tests for anterior talofibular ligament integrity. Differential diagnosis of gluteal and hamstring weakness versus an L5-S1 radiculopathy. Gluteal and hamstring weakness may include isolated weakness in hip extension, abduction, and external rotation, isolated knee flexion weakness, positive Trendelenburg sign, which Taylor is demonstrating right now with her gait, normal reflexes and sensation, hip active range of motion deficits due to weakness but full passive range of motion. L5-S1 radiculopathy may present with pain radiating into the lower extremity, sensation deficits in the L5-S1 dermatomal pattern, myotomal weakness in plantar flexion, knee flexion, and great toe extension, diminished or absent Achilles tendon reflex, a positive straight leg raise, and well leg test. So for the straight leg raise, I'm going to go ahead and raise Taylor's leg, looking for any symptoms in the test leg, as well as asking for any symptoms in the non-test leg for a positive well leg test. We also have a positive slump test, which was demonstrated earlier, abnormal imaging such as disc herniation.